I know this podcast has a bit of a funny title, but this is really something I'm very passionate about. When someone comes into my office, my goal is to give them the best advice on what would make them look the best. So oftentimes patients come in and they're bothered by, for example, a little crease near their mouth or wherever it may be. Women in particular are very what I call left brain. In other words, they are always looking for these little asymmetries or these little creases or this little wrinkle or that little flaw that they think makes them look bad. And I always want them to understand as an artist, I do portrait paintings and landscapes. Every day I work on different artwork besides on faces. And I always try to tell them, look, you got to take 10 steps back and look at it. Like when I'm doing a painting, I step back 5 or 10 feet repeatedly to look at if the whole picture is working. And that's what I try to encourage patients is look at the big picture. How do people look at you? Even if people say, look, I don't really care how people see me, I just care if I'm happy. Well, there's two things. One is if it's a little minutia that no one can see, I may never get that flaw corrected enough that would be worth your time and money to do it. And you may just be aggravated that I didn't fix what you wanted to have fixed. And the second thing is that I try to encourage patients to see the big picture, because when you really see the power of the beautiful things I can do to balance things, then you understand that that's really the what's worth it. And balance is everything. I just had a African American lady come in that wanted the sides of her nose brought in only, and I showed her that by doing that, it made her tip look worse. She wanted her lower lip reduced because it was hanging, and I explained that if I reduced too much, it would make her top lip look too large. And so balance is everything. And so you got to take a step back and look at the whole picture. By doing so, you can make a judgment which makes sense. So, for example, if you have a very large nose, I may say, hey, a chin implant may be worth it to give you better balance, even though you may never have come in to ask me about the chin. And so I'm going to give you that advice. And I always say that, this is a menu. If you don't like to do a certain thing, like you don't like filet mignon, but you like sea bass, then I can show you the sea bass, but you may not know sea bass is on the menu. So I'm not here to insult you or aggravate you if I'm offering you ideas that you may not have otherwise thought about, but I'm going to show you those items. Or even if you come in and you have very fake lips, I'm going to tell you your lips look unnatural. I had a lady that came in for a fat grafting and said, I'm just nervous. I'm going to look like Meg Ryan. I'm going to look overdone and overfilled. And I had her take her mask off, and she already looked overdone, overfilled with fillers. And I was shocked that she couldn't tell that she looked fake already. So, and I had to dissolve out all her fillers so that I could do the fat grafting to balance her. And make her look more natural. Now that I did the fat grafting, she looks so much more balanced and so much more natural, but she couldn't even tell she looked fake. So this is the art of the consultation, is not just to say, I want A, Dr. Lamb, and I'm just going to hand you A. I'm going to say, well, A may be worth it, may not be worth it. If I were you, I would look at these things that may be categories that would be more worth it for you to consider. And so that's what I mean by a facial financial advisor. I'm here to give you a vision of where you can allocate your funds in the short range and the long range, what may be worth spending, what may not be worth spending, and prioritize all of that for you.